and only 46 confirmed. We're getting zero cooperation on the personnel part of the Senate portfolio, which is confirming nomination. Therefore, we will be in session the first 2 weeks of August that we had originally anticipated not being here. We will be here. We've got the defense authorization. We've got the debt ceiling. We've got the FDA user fee and other important legislation that we need to address, and we simply, as a result of all this obstructionism, don't have enough time to address all of these issues between now and the originally anticipated August recess. So we'll be here the first 2 weeks of August.
Of course, we remember the promises made when Obamacare was sold. If you like your doctor, you can keep your doctor. If you like your plan, you can keep your plan. That family of four would see a reduction in their premiums of $2,500, none of which is proven to be true. So based on the experience of the last 7 years, I think it's fair to say that Obamacare has been a failed experiment. And we have two choices: to try to do better, to stabilize the markets, to bring premiums down, to protect people with pre-existing conditions, and then to put Medicaid, the safety net program for the poor, on a sustainable fiscal path, or what Senator Schumer and Senate Democrats apparently believe is a better course. No reforms, no changes, just bail out insurance companies by throwing billions of dollars at them without any reform. We're not interested in that. We think we've got a better plan. We invite our Democratic colleagues to join us. Under the budget process, they have an opportunity to offer amendments to the plan. There's no restriction. So we would invite them to participate in the process to come up with a better product than the failure of Obamacare, much less bailing out insurance companies by throwing billions of dollars at them, trying to prop up a failed experiment.
And the news on health care doesn't get any better for people in this country. There are going to be 2 million fewer people this year with insurance than had it last year. So the number of uninsured goes up. The cost continues to go up, probably a correlation there. And the highest number of people in this country in a Gallup poll now cite health care as being the #1 economic concern, highest number since 2007. And in fact, that number's gone up 7% since Obamacare was implemented in 2013. So people are priced out of the insurance marketplace, and as a result of that, you see collapsing markets, you see skyrocketing premiums, and you see people with fewer choices and fewer options. So our goals very clearly and simply are: 1, stabilize insurance markets; 2, liberate people from mandates that force them to buy insurance if they don't want and can't afford; improve affordability so that people can afford to have health insurance coverage in this country; preserve access for people who have pre-existing conditions to health care insurance; and then finally strengthen Medicare for the people who really need it, and making sure that we don't pull the rug out from under those people who really do need it, but make it sustainable for future generations. That's really the goals that we have in this effort. It's clear that Obamacare, as we know it today, is failing. It is a failed program, and it's the American people who deserve better, and we intend to give it to them. And that's what we plan on voting on next week.
The pain of Obamacare continues to worsen. The NBC News report points out that 2 million fewer people are insured now than at the beginning of the year. They tend to be younger people, and it's because they cannot afford the insurance under Obamacare. They cite the main reasons: higher cost, fewer choices. And with regard to fewer choices, front page USA Today, 4th of July, 1,370 counties down to single choice of insurers. That's not a marketplace, that is a monopoly. So over the 4th of July, I was home at community events at a number of hospitals, visiting with patients as well as doctors and nurses. They want a fundamental change away from Obamacare and toward freedom, and that's what we're offering. We're eliminating the mandates, the employer mandates and the individual mandates that people have to buy a government-approved product. We eliminate the taxes that raise the cost of insurance for the American public, and we lower premiums. Even the CBO says that the Republican plan would, by 2020, lower premiums by 30%. We give authority back to the states, decisions closer to home. Washington's one-size-fits-all certainly doesn't work in my home state of Wyoming. For people with pre-existing conditions, certainly they are going to continue to be covered. People up to the age of 26 staying on their parents' plan, absolutely. We know that it's a challenge. We know we have a responsibility and an obligation to get this done because the death spiral of Obamacare is upon us. The American people deserve better.